Good evening, everyone. Let's just give 2 minutes for other people who are still joining to join, or 3 minutes, and then we'll start. Thank you very much. Okay, I think we can start. Good evening once again for those who've recently joined us. Um, my name is Dr. Martin Macau. I'm one of the doctors with HealthX Africa. For those who may not be familiar with us or are joining one of our webinars for the first time, HealthX is a health care provider. Take it like a hospital, but with a twist in that we provide most of our services through telemedicine, meaning through video, voice, kind of like what we're doing right now, and sometimes chat for the people who want to chat, among other services. We also have a mobile app that does things like um, health education, following up on your health and well-being, and so on. So tonight we're going to be having a talk, or rather, um, an ongoing series, an ongoing education series on health in the workplace that we've been having. So today we're actually going to be dealing with mental health in the workplace, and something known as imposter syndrome. So as HealthX, in as much as we do have fully employed doctors working 24 hours a day, providing services on a telemedicine platform, or mostly on a telemedicine platform, we do have clinical psychologists like the one who's going to present this talk to us. And also we have a nutritionist, because we understand that healthcare is not just when you fall sick, and it's not just in the body, but also in the mind and even what you eat. Basically, just trying to stay healthy. Other than treating illnesses, also we try to stay healthy. So the topic today is imposter syndrome, um, which I'm sure a number of us are curious about. Maybe some of us even know about very well and would like to know more about it and what we can do about it. Basically, where you feel like, in short, I don't want to give any spoilers to the talk, but where you feel like you don't belong or you don't deserve to be where you are, where you feel like maybe your position is too big for you, your new job, your new position could be too big for you, or anything else. Might not just be workplace. So we'll even try, in as much as we're calling it workplace, because it's where it most commonly happens. It could be happening anywhere else where you feel like you're lucky or you're too lucky or you don't deserve to be where you are. So without it giving any more spoilers, I'll hand over to Sylvia Quara, who's our clinical psychologist. Um, Sylvia has extensive experience when it comes to mental health. She has a master's in clinical psychology, so we are in good hands. Imposter syndrome mostly happens in the mind, so she'll tell us a lot more about it. So Sylvia, welcome, and take us through. In case you have any questions, feel free to put them in the chat at any time. Even at the end, we'll have a Q&A session where we can tackle any questions you could be having that might not have been covered or might not be very clear to you in the presentation. Thank you very much for joining us this evening. And Sylvia, the floor is yours.
Thank you, Dr. Martin, for that introduction. I'm seeing in the chat box a lady called Anne. She's saying she's not able to hear. I hope others are able to follow.
If anybody isn't able to hear, just put it in the chat box. I can see some people are able to hear. Yeah, including Anne. So I guess we're good to go.
Okay, thank you so much. Yeah, so tonight we'll be speaking about imposter syndrome. And we are looking at mental health in the workplace. So imposter syndrome, most of the time affects the workers, affects people in the workplace, but that doesn't mean that you cannot experience this when you're in a different setup. Yeah, so when it comes to imposter syndrome, this is a gray area, especially in the field of mental health. No much research has been done in this area, but this syndrome affects a number of people. And some of them may not even know that this is what they're experiencing. So tonight, we'll be trying to dwell deeper and try to understand what is it so that we can be able to see if this is something that we have been struggling with. And if that is the case, what are the options that are there for you to be able to overcome this particular syndrome. So I'll be looking at a number of things. So I'll do the introduction, then I'll be able to define what imposter syndrome is, and then I'll be able to explore more about imposter syndrome. Then I'll look at how do we assess or even diagnose imposter syndrome. What are the statistics? How prevalent is imposter syndrome? And then we'll also look at the risk factors. Are some people more at risk of getting imposter syndrome than other people? So we'll be able to look into that. And then we'll also look at what is the impact, what are the effects of someone having imposter syndrome. And then lastly, we'll be able to look at some of the tips that you can be able to take as an individual to overcome once you're able to understand what it is, and even some of the tips that you can be able to use and help someone else who is also struggling with that. And we'll also look at maybe professionally, how do we help people who are struggling with that. So those are some of the things that we'll be able to look at. Someone is saying that they can't hear anything. I hope others are able to hear.
If someone can't hear, just try logging in and log out and log in again. Sylvia, just continue with the presentation. I'll deal with these other things.
Okay, that's fine. Yeah, so work is a major part of our lives. This is where we spend much of our time, where we may have most contact with other people, where we make money, and where we sometimes make our friends. So 70% of our time is spent at work. And then having a fulfilling job is good for your mental health and general well-being. So when you have a job that is fulfilling, then that is actually good for your mental well-being. So what is imposter syndrome? So imposter syndrome can affect anyone, regardless of gender and job or even social status. So anyone can be affected, affect people equally, both male and female, whether you are in a low-paying job or a high-paying job, regardless of your social status, socioeconomic status. So, and it is most common among workers, especially those who are driven to achieve. Those workers who are driven to achieve, they mostly are encounter or they normally experience imposter syndrome. It stems from low self-esteem, but it can be easy to underestimate because people hide it and soldier through. Yeah, so and I'll be looking at that, the relationship between imposter syndrome and the low self-esteem. So many people experience symptoms for a limited time, such as in the first few weeks of a new job. For others, the experience can be lifelong. Yeah, so and this depends with a number of factors, with the personality, how the person is able to adjust, and many things that we'll be able to look at. And the imposter syndrome, it normally occurs at a transition points. And when I talk about transition points, uh, this is where someone is moving maybe from one position in an organization to another position, and most of the time a higher position. Or maybe someone is moving jobs. Maybe you are moving from one organization to another. So when you get into another organization, you might find yourself experiencing that. Or maybe when you get a promotion. So what is imposter syndrome? It refers to an internal experience of believing that you are not as competent as others perceive you to be. So this is an internal experience. So it is subjective. It's not what other people feel. So it's just someone who is experiencing. It's subjective. You are believing that you are not as competent as other people perceive you to be. So, and most of the time, this syndrome strikes smart and successful individuals. It is often experienced when one has a notable accomplishment, like maybe you have earned a promotion, maybe you have won an award, you have been admitted to a prestigious university or even a college. So you don't believe, you feel like you don't belong there. You have that experience that you are not competent even to have gotten that kind of an experience. So mostly occurs at that particular point where someone has been able to accomplish something, or maybe there's some kind of notable accomplishment. Then this kind of feeling will be able to come in. So there are three categories when it comes to imposter syndrome. We can categorize it into three. First of all, it is the attribute. So the attribute, so this is where now the person has a tendency to attribute success to luck or to other external reasons and not their own internal abilities. So someone feels that, the reason why I got this job is because I was lucky, or it's because someone else did this to me, or someone else was able to come in and say that I deserve this, but they don't believe that it is their own abilities. So they attribute their success to other external factors. And then it also the other category is the feeling. So there's the attribution where you don't own your success, and then now there's the feeling. The feeling here is the belief that one does not deserve success, and this can be either academic or even professional. Yeah, so, and that somehow others have been deceived into thinking otherwise. So they feel that that success is not theirs. So other people have just been deceived to believe that they deserve that. And then this goes together with a fear of being found out, discovered, or unmasked. So they live in fear that other people are going to realize that they don't deserve that, or maybe they got that promotion by mistake. So they have that particular fear. So the feeling that they get is the fear. And then there's that aspect of discounting. This is a tendency to downplay or discounts ability or achievement. So someone's tell you, congratulations, you know, you are the CEO of this particular organization. And then the person say, leave alone that, that is just a small thing. So you just want to downplay whatever achievement that you've gotten. So it can come in that particular category. And then when it comes to imposter syndrome, we can be able to look at it into 5 basic types. Because when it comes to syndrome, syndrome is a collection of many feelings, is a collection of many things. So imposter syndrome can be broken down into 5 basic types. So the first one is the perfectionist, and then the second is the expert, and then the third one is the natural genius, and then the fourth one is the soloist, and then the fifth one is the super person. So if we look at the first category of the imposter syndrome, that is the perfectionist. These are people who set extreme goals for themselves. And when they fail to reach a goal, they experience anxiety or even self-doubt, or even they worry. So their perfectionist trait make them believe that they are not as good as others might think. Because with the perfectionist, they want to look like they are good. So they're able to set very extreme goals, the goals that are not attainable, because we know that in life, it's important that for people to be able to set smart goals, goals that are measurable, goals that are achievable. But now for the perfectionist, they're able to set extreme goals. So when they are not able to achieve that, then you find that they'll be able to experience worry. And then as much as they are doing well, other people are able to see that whatever they have been able to achieve is okay. For them, because they have not been able to reach their goals, they tend to believe that they are not as good as other people think. And then now we have the expert. So the experts will never feel satisfied because they think they haven't known everything about the subject. I want to study more about the universe. So I feel that there are lots in the universe that I've not been able to understand. Or maybe we have an expert in politics, and then the person feels that there are certain things that have not been able to do what to understand. So they'll never feel satisfied because they haven't known everything. So because there's always more for them to learn, they fear being exposed as inexperienced or unknowledgeable. Yeah, so they feel that there's a lot. So there is that tendency for them to keep on, looking for knowledge, and they fear that people might find out that they are not as good as, other people think. And then we also have the natural genius. So these people, they believe that they are naturally intelligent or competent. So if they don't get something right the first time round, if they take long time to master something, then they feel ashamed, because now with the natural genius, for them, their belief is that I should not even struggle to think about something. I should not struggle to think about the solution. So when that happens, then you find that they are going to experience a sense of imposter. And then we also have the soloist. The soloist, they fear that asking for help will reveal their incompetence. So they may turn down help to prove that their self-worth. So soloists, these are people who like keeping to themselves. They like being alone. They always isolate. Yeah. So and these are people who also have social anxiety. We'll be able to look at that. So for them, asking for help mean that they are not competent. Yeah, and we know that as a human being, you may not have everything, and you can ask help, not necessarily monetary. It could be help in form of other things. So with the soloist, they feel that asking for help will reveal their incompetence, so they may turn down any help to prove their self-worth. And then we have the super person. This type believes that one must be the hardest worker or even reach the highest level of achievement possible, and if not, then you are fraud. So because this is just a belief, this is a super person, and that is the belief that they have. They must be the best in that particular organization. And if something happens and they have not been able to reach that, then they might feel that they are not as competent, or they might doubt their skills. So those are the five types of imposter syndrome.
Sylvia,
Yes.
sorry. On the five types, is it possible for somebody to have more than one type?
Yes, yes, it is possible. It is possible for someone to have more than one. So you can be a soloist, and then you also a perfectionist.
Okay.
Thank you for that. Yeah. So imposter syndrome, as I said, this is still a gray area in the field of mental health. So currently, as we speak, we don't have any diagnosis available for imposter syndrome. Yeah, so imposter syndrome is not a recognized disorder, and the Diagnostic and Statistical Manual of Mental Disorder, that is the DSM-5, and even the International Classification of Diseases, that is ICD-10, does not list criteria for diagnosing it. So currently, as we speak, we don't have any criteria to diagnose someone who has an imposter syndrome. Yeah, but hoping that when the revisions are done, because revisions are normally done periodically, they are going to include that. But as we speak, currently, we don't have any criteria for diagnosing imposter syndrome, because for mental health experts, we normally use the DSM-5, the DSM, or even the ICD-10 to be able to diagnose most of the disorders, most of the mental disorders that are there, maybe depression, anxiety, bipolar, all that. But for imposter syndrome, currently we don't have any criteria for diagnosing it. But it's important to note that imposter syndrome is often comorbid with depression and anxiety, and is associated with impaired job performance, job satisfaction, and burnout. And when I talk about comorbid, I'm saying that most of the time, people who experience imposter syndrome, they'll also experience depression. They'll also experience anxiety. So they come together. Comorbid means two disorders occurring at the same time. So, and you realize that when someone comes to us, maybe for assessment, we might assess what? Depression, but maybe this depression is actually coming with imposter syndrome. And it's also important to note that there's an overlap between imposter syndrome and social anxiety. So a person with social anxiety may feel as though they don't belong in a social or even performance situations. And they may feel as though people are going to discover their social incompetence. Yeah, so you find that people with social anxiety, they fear, being exposed. They'll always fear social situation, or where they have to present something. So you find that with imposter syndrome, it can also appear like that, because someone with imposter syndrome will not want other people to notice that their incompetence in a way. So sometimes there's that kind of overlap. So somebody might diagnose social anxiety instead of picking the feelings of imposter syndrome. So when we are saying that there's no diagnosis, so how do we assess if someone has imposter syndrome? So most of the time, what we do, we assess the feelings. we assess imposter feelings. And with the imposter feelings, it comes with feelings of unworthiness, feeling of not belonging, feeling of self-doubt, feeling of not being perfect and all that. So those are the things that we are able to do, what we are able to assess. And then as mental health expert, then we are able to work on those particular feelings. And most of the time, when people come to us and they are presenting with work-related stress, we normally try to assess also for imposter feelings, especially when someone is coming and they are stressed, or maybe they're experiencing anxiety, and those anxieties are as a result of work related. So as much as possible, we'll try to see if they could be having some imposter feelings. And also, when it comes to assessment, we also assess for comorbidities. As I said, imposter syndrome will come with another mental disorder, will come with another stressor. So we can assess also for comorbidities like anxiety. We want to look at where is this anxiety coming from? What is bringing this anxiety? Has it come as a result of promotion? And maybe this person is feeling not competent in that particular position. Then at that particular point, we'll say that now it's anxiety, but it's also comorbid with maybe imposter syndrome. So we'll also assess for depression. We'll also assess maybe somatic symptoms, because you realize that this person is always want to prove that they are better, or maybe they are always in a state of anxiety. So you find that they might develop some physical problems like headaches, maybe stomach aches. So those are what we are calling somatic symptoms. So these somatics, these are physical symptoms, but they are psychological in nature. We'll also assess for low self-esteem, also social dysfunction, because you realize that if this person feels that they don't belong to that work environment, then they will not be able to perform optimally. So there will be social dysfunction in one way or another, or maybe this person will not be able to interact well with the colleagues. So those are the things that we normally assess, especially when it comes to imposter syndrome. So we assess the feelings, and we also look at the comorbidities, and then from there we can now be able to help an individual work on some of those areas that we have been able to assess. So let's look at some examples of people who have experienced imposter syndrome, just very prominent people, people who have had impact in the society, but at some point they felt like they never belonged, or they actually doubted their abilities. So so the first one, we have this lady here. So at one point, she said that I have written 11 books, but each time I think, uh, oh, they are going to find out now. I've run a game on everybody, and they are going to find me out. So this person has written, 11 books, but at some point, this kind of a feeling came in. They are doubting that they are the ones who have been able to write that particular book. And then we have a guy here called Albert Einstein. He's actually a renowned scientist. He has developed so many theories, that even psychologists use. So at one point, this is how he felt. This was just a feeling that he was having, the exaggerated esteem in which my life work is held makes me very ill at ease. I feel compelled to think of myself as an involuntary swindler. In other words, involuntary fraud. Yeah, because many people quote his work. So he feels like, his esteem is somehow exaggerated by other people. So it makes him feel ill at ease. So that's the feeling of imposter syndrome. And then we also have this lady called Margaret Chan. She was a director of WHO between 2006 and 2017. And at some point, this is how she felt, because the feeling was everybody else knows more than me. That is also a feeling of imposter. So this was the feeling. So there are an awful lot of people out there who think I'm an expert. How do these people believe all this about me? I'm so much aware of all the things I don't know. So this is just the internal feeling that this lady was having, because people think that she's an expert. They believe that, this lady is good at what she's doing. But for her, she feels that there's a lot that she still doesn't know. So that is a feeling of an imposter syndrome. So just take a moment, just a brainstorming activity where you are. So I want us to review these 4 questions and look if any of this applies to you. So we have 4 questions here. So if you answer yes to any of these, then it means that you could be having some imposter tendency. So the first one is, you tend to be crushed by even positive criticism, seeing it as evidence of your inemptiness. So have you ever felt like that? Maybe your boss has criticized you, given you a positive criticism, maybe regarding a project that you wrote, and gave you some positive feedback. And then for you, you felt like, yeah, actually, they have seen it. I'm not competent enough. So you see it as evidence of your inemptiness. So that means that you could be having some imposter tendency. And then the other one is, you believe that other people are smarter and more capable than you. So other people are good. You are not good. And then the other one is, you live in fear of being discovered or unmasked. Yeah, so you have a position in your organization, or maybe you are admitted in a prestigious university, and then you feel like people are going to discover that you are not as smart as they thought. So you live in fear. And then the other one is, you shy away from challenges because of self-doubt. So you don't want to take any challenge that is brought to you, or maybe if there's something at the workplace. Maybe the boss has said that we need people who can be able to volunteer to work on certain thing, on a certain project. And you know that you have the capacity to do that. So what do? You want to shy away because you feel that other people are going to discover that you are not as competent, or even you are doubting your abilities. So that if you answer yes to any of those, then that means that you could also be having some imposter tendency. So I don't know if you have been able to look into that. So you can just try to look into that. At any point, have you ever felt like that? Okay, so let's look at some statistics and the prevalence of imposter syndrome. So according to the International Journal of Behavioral Science, it is estimated that 70% of the population will experience imposter syndrome at some point. So that's huge. That's it means that many people, that is more than half, 70 people of the population will experience imposter syndrome at some point. And then a KPMG study in 2023 finds that 75% of female executives across industries have experienced imposter syndrome in their careers, which is a feeling of inadequacy, self-doubt that makes them continuously doubt if they are qualified enough for the job. So you can imagine this is 75% of female executives. They have experienced that. This is just a study that was done by KPMG. And then much of the earliest literature, it focused more on women. When it comes to imposter syndrome, the focus was more on women. But nowadays, we are realizing that imposter syndrome affects both men and women equally. And then imposter syndrome affects individuals across the age spectrum, though research indicates that increased age is also associated with decreased imposter feelings. And this is according to the research that was done by Chai, Piedmont, and Estad in 1995. So as people continue to age, then you find that the imposter syndrome, the imposter feeling decreases, but it affects people across the age spectrum. So how does it look like? How does imposter syndrome looks like? So it looks like this. Yes, you have been successful, but you're saying, I'm just lucky. Maybe other people were not lucky, so I'm just lucky. So you don't feel like it's about your abilities. It's also the feeling like I'm a fraud. I'm a con person. People are going to find that I'm not authentic, so I'm a fraud. Yes. And then it looks like people are onto me. People are looking up onto me. They are going to find out that I'm not the person that they are seeing. And then it looks like other people are better than me. So you feel that there are other people are better than you, and you are not good. It's not perfect. It's a feeling where you feel like it's not perfect, because we say that one type of uh, imposter syndrome is the perfectionist. Yeah, so you always feel that it's not perfect. Something else has to be done. And then it is a feeling like they all know that I'm fake, I'm not authentic, or I'm never good enough, or I don't deserve it. So that is how the imposter syndrome looks like. So all these feelings are able to add up into imposter syndrome. So what are the risk factors for imposter syndrome? One of the risk factors is family influence. And actually, this is very, very important. And it's important that we also take note of this. And especially in families where there are certain messages that are normally given about success and failure. So like in some families, you're going to realize that it's a family of doctors. So if you are not a doctor in that particular family, then you'll feel like you are not successful. Even if you ventured into a different field and then you became successful, then you as a person, you'll feel that maybe I'm not successful. Or maybe you are in a certain family where they think that success is having your own business, and you've not even gotten your own business, or you've not even started a job to start your own business, then you realize that you feel like you are not successful. So what are some of the messages that have been said about success in your family? So you realize that that is actually very key. Or maybe in some families, they stress more on performance, maybe children getting A's or getting B's. So you find that if a child gets a different kind of a grade, then they feel that that is not successful. So if this child gets maybe a D, and they're able to climb in the ladder, and then they become successful later on, you'll find that this person will still struggle with the success that they have, because they know that people who can be successful are the ones who are able to perform in a certain way. So you find that those early family influences on messages about success and failure have an impact on how the person is going to on how the person is going to develop the imposter syndrome. And also myths and labels about success. Sometimes in some families you realize that people have labeled them in a certain way, that maybe this family will never succeed. This family, they belong in a certain category. So if you become successful and you come from a family that is of low socioeconomic status, then it becomes hard for you to be able to believe your success. And then another risk factor is a decision to pursue an alternative path. For example, you're in a family where you are told that you need to become a teacher, and then you decide that I want to become a DJ. So you pursue an alternative path. So when you become successful in that alternative path, you can have problem accepting your success. You will doubt your success. And then pressure to represent your group, and especially if you come from a minority group. So you find that there'll be that pressure, because there is a limited diversity. So you'll find yourself struggling a lot. Or maybe if you become successful, everyone in that particular group are looking up onto you. So you'll find a lot of pressure to be able to ensure that there are no mistakes. So when that happens, then you realize that you are at risk of developing imposter syndrome. And research also indicates that people who come from minority group are at higher risk of also developing imposter syndrome. And then the other risk factor is unsupportive organizational cultures. So there are some organizations where there's a lot of competition, there's some hostility, no support. So when that happens, when you find yourself in that kind of an organization, then you'll find yourself always doubting, because everyone is on the move, everyone is on the run, wanting to outsmart the other person. So in that kind of an organization, then you find that there's a high tendency of someone developing imposter syndrome. So what are some of the impacts? What are the effects of imposter syndrome? So one of the effects, especially at workplace, is decreased work performance. So you find this person we might shy away from taking even responsibility because they doubt their abilities. So they may not be able to perform optimally. And then also fear of taking responsibilities, what I've just talked about, they are doubting themselves. And then they attribute success to outside factors, so they don't own their success. And the moment you attribute success to outside factors, you may not be able to appreciate the abilities that you have as a person, and maybe use the same abilities to succeed in other areas of your life. So you find that becomes a challenge. It becomes hard for them to accept praises and even compliments because they don't believe in that. And then job dissatisfaction and burnout. So this is someone who will keep moving from one job to another, or maybe they are in a job, a certain job, and they are not able to perform well. They have diminished energy. They are not able to become professional enough. They are not able to use their skills well. So that is burnout. There's high chance of them experiencing burnout. Most of the time, they avoid seeking promotion because they don't want to be at the limelight where everyone is looking unto them. Because remember, I said that most of the time they have low self-esteem. So they'll, as much as possible, they'll want to just remain at an average position, and they'll always avoid seeking promotion. And then the other impact is low self-esteem, low self-worth, relationship issues. Yeah, so these are people who will have problems with people because they don't accept any compliment. And you see now, as human being, when you interact, you share experiences, you affirm others. But now if the person is actually rigid and they are not able to accept any affirmation, then it becomes difficult for you to relate with them. So so that is something that they experience. And then there's also the mental health impact, like depression. Most of them are prone to depression. Most of them are prone to anxiety, somatic symptoms, and many more. And then the other impact is unreached potential. So most of the time, these people with the imposter syndrome, they may not reach their potential because of the fear, because of the fear to be seen, because of the fear, because of the doubt that they have. So they may not be able to reach the potential that they ought to reach. So that is also an area that might hinder them from succeeding. So you can see that with the imposter syndrome, it makes someone now to become average, just a place where they don't want to climb in the ladder. So, and it's important when people reach out so that they can be helped, and then they can be able to reach their potential. And then there's also a high link between imposter syndrome and burnout, especially at workplace. So feeling like you are bad at your job is, your job, bad at your job, you are miserable, worse, it's also more likely to lead to professional burnout. Yeah, so, when you feel like you are bad at your job, you are not good, you are doubting yourself, this will actually lead to professional burnout because studies suggest that up to 70% of people have experienced imposter syndrome at work at some point. So you realize that if this is the case, then when burnout results in, then low productivity will be there. So the stress of constantly questioning oneself is frequently compounded by the anxieties, which can make someone exhausted daily because you are always stressed, you are doubting yourself. So you find that your energy level will be depleted, and even your professional efficacy will also come down. And now that is what we call professional burnout. And when professional burnout occurs, then productivity will also go down, and most likely this person may not be able to keep their job. So this is someone who will keep moving from one organization to another, because yes, maybe for one reason they had imposter syndrome, and then they developed burnout, and they were not able to perform as they ought to perform. So why does it matter? Why is it important for us to talk about imposter syndrome? One of the things is that it makes one miserable. It makes one feel bad. It makes someone's life not enjoyable. You are living in a state where you are not happy. You are successful. People are praising you. People are saying, oh, Sylvia, you have been able to do well. But for you, you feel miserable. For you, that promotion is not good. So, you don't appreciate that. It doesn't make you happy. So, if that is the case, then this matters a lot. Then it means that we need to talk about it. Then it means that you need help. And then imposter syndrome also inhibits one aspiration. It inhibits your aspiration. It inhibits, your goals, your visions. You feel like you don't want to do what you don't want to work hard. You don't want to reach there because of fear that people are going to discover you. And then it makes you undersell yourself. I've heard of many people, as I interact, sometimes they say that even when they're applying for jobs, sometimes they fear maybe putting their degrees, the number of degrees that they have done. Or some of them, they don't even put their experience, the number of experience that they've had, because they fear that, if they do that, then they are going to be given maybe a bigger job, or something like that. So they'll actually undersell themselves. So maybe someone has a degree, but they are going to say that I have a diploma. Maybe they have a degree and a diploma, so they'll opt to sell their diploma. So underselling themselves, yeah. So that means that they want to reduce others' view of their capabilities. They don't want other people to know that maybe they have a PhD or maybe they have a master's. So they'll actually ensure that they undersell themselves. Yeah, and then it reduces their willingness to speak up in meetings and even on paper. So these are the people who will go into meetings, and they will not say anything in that meeting, or they'll just even say a word because of that particular fear that people are going to discover that, oh, maybe they don't speak very well, or maybe they don't know what they are doing. So they'll always, as much as they have ideas, as much as they have good ideas, they will not be able to do that. Or even if they do, then they'll be able to do it minimally. And then it also reduces their influence on outcomes. Yeah, so they will not contribute to suggestions. They'll not contribute to what other people are saying, because they don't want to be the ones who have been able to influence the outcome. And then it also reduces, their reduces their opportunities to find things out. Yeah, so because of the self-doubt that they have. And also, why it matters is because this person will have fewer opportunities for career advancements or even new experiences because of the fear. So they will not even look for big jobs. They'll not even apply jobs to some of these big organizations because of the fear. That they have, or if they're in that particular organization, they'll always hide, or they'll always hide their abilities, and they may not be recognized, and they might tend to remain in the same position that they are in. Yeah, so when it comes to imposter syndrome, it normally happen in a cycle. And as I said, for people who have experienced imposter syndrome, success does not mean happiness. Someone has been promoted, you are manager, and the expectation will be you need to be happy. But now this person becomes sad. Success for them is not, is not happiness. For them, success is a problem. So success does not mean happiness, because now that is the beginning of problems. That is the beginning of anxieties. That is the beginning of depression. Most of the time, I see clients who come to me and share the experiences. They have had promotion, they are doing well at work, but you realize that something is not okay. Despite that, despite the promotion, despite what is going on, the good things that other people will want to, they will see it as a success. For them, that is not a success, but is actually the beginning of their problem. So normally, this is what it happens. You are given a task to accomplish. So let's say there's a certain project or a certain proposal that you have been given. So you need to finish that particular proposal. So it starts there. So there's a task to accomplish, or you have been promoted and you need to accomplish a certain task. And then what happens is when you are given that task, you start experiencing anxiety that I'm not sure if I'll be able to do this. I'm not sure if I'll be able to succeed in this particular position. I'm not sure if I'll be able to write this proposal well. So anxiety trickles in, and then now what happens is that there is over preparation or even procrastination. So you find that you tend to do a lot. Like you tend to read a lot, like when it comes to our preparation, you can spend the whole night just trying to see how that proposal can come along, of which preparation is okay. Remember here, the point here is over preparation, because it's important that you also prepare. It's important that you work on that particular thing. But now, because of the anxiety, this person will tend to over prepare, and that anxiety will not even allow them to even sleep. Or on the other hand, it will be that they are procrastinating. If not over preparation, it will be procrastination. And then now what happens? So there is over preparation or even procrastination. And then at the end of the day, what happens? Then there's accomplishment with positive feedback. So they have been able to accomplish the task. So they are given feedback. Wow, that was a good proposal. Or that was a good performance in that particular role. So positive feedback is given. So when positive feedback is given, then this person feel like that is not me. So they discount the feedback. They feel that it was lack. They don't perceive it that it was their hard work. So you find that there's that negativity that comes in. So when that negativity comes in, then what happens? Then there's depression, increased self-doubt. There's depression, and also there's also the anxiety. So it starts with that task. It starts with the work that you have been given. So you start doubting if you're going to accomplish, and all those things gets in. And then now it reaches a point now where now you start having some of these comorbidities. You start experiencing depression or even anxiety as a result of what? As a result of imposter syndrome, as a result of self-doubt. So what are you supposed to do? So maybe looking at that particular cycle, this is what you can do, especially when you experience some of those particular symptoms. For example, when you are given a task and anxiety start trickling in, you can pause a bit and ask yourself, where is this anxiety coming from? Is it about this task? Ask yourself, are you able to do this? Maybe you can tell yourself, I can do this, because now with the anxiety, it's telling you that you can't do this. And then now when you tell yourself you can't do this, then you find that there's increased energy level within your body. You start feeling anxious. You start wondering what is going to happen. So also telling yourself that you can be able to do this is very important. And then sometimes someone can procrastinate. So, okay, let me not start it today. I feel terrible. So the good thing is that if you can be able to get started immediately, then that will actually be able to set a pace. Because the moment you keep on procrastinating, it will reach a point where you will not even do it. So what you need to do, start it immediately. over preparation, because as I said, sometimes people can tend to over prepare. So what you can do at this particular case is you need to set a timeline and a goal. Maybe you tell yourself in 3 months time, I need to have done this and that, so that if you are given yourself a timeline, then it will also be able to give you a leeway not to feel like you have to go for sleepless night for 3 months or even for 1 month. Yeah, so set a timeline and also set a goal. And then the aspect of discounting praise, ask yourself, why are you doing that? Is it validated in one way or another? So you just need to pause a bit and ask yourself, yes, I've been praised about this. So why is it that I'm invalidating that? Why do I do that? So you actually need to do or to have a self-talk. And if you realize that you are not able to answer that, then there are also other tips here that we'll just talk about it, or you can even be able to see a therapist who can be able to help you navigate through that, or even answer some of those questions that you may not have an answer to. So some of the tips that you can be able to use to overcome the imposter syndrome is, first of all, you need to challenge your negative thoughts, and these negative thoughts are coming as a result of the belief systems that you have. You could be having some negative thoughts that people from my community cannot succeed, or maybe in my family, I got this particular grade, so there's no way I can be able to do what to succeed. Or maybe I'm new in this particular organization, so there's no way I can get this promotion, and other people have been here for quite a long time and they have not been given that promotion. So what are some of those negative thoughts that you're having? So you need to challenge them. And then it's important that you also acknowledge the presence of imposter syndrome. First of all, accepting that I have this problem, that I'm feeling terrible, that I'm feeling this way. So acknowledge that. So once you acknowledge that, then you can be able to share your feelings with other people. You can share with a colleague, you can share with your loved one what you're feeling. And if you realize that maybe there are no people that you can share with, then you can also share with a therapist. Or maybe if you don't want other people to hear what you're feeling, then you can be able to share with a psychologist, and then those feelings can be explored. So acknowledge the presence of that and then speak out. The other thing is, it is important that you also own your success. Remember, when it comes to mental health, people can grow when they receive feedback from people, when they become aware that this is actually what is happening. So when you become successful, when people give you some acknowledgement, when people are able to see what you are doing, then it's important that you own it, because when you own it, that success will also help you to succeed in other areas. You can use the same strategy that you have used maybe in this particular area. Maybe this is your career. You can be able to use the same strategy even to succeed in your family, or even to succeed in other areas of your life. But now, if you don't own it, then you realize that you may not even tend to, you might find yourself not wanting even to work hard or something. So knowing that that is your strength, you can be able to use even that strength to be able to do more things. And then also accept external validation, because sometimes we may have some blind spots, some areas that we don't know as human being. Maybe I have a blind spot. There are certain traits that I don't know about myself. There are certain issues that I don't know about myself. But when other people tell me about that, then I become aware. Then when I become aware, then if it is something that I need to work on, then I can work on it. So when people give you some validation, it means that, yes, you are capable. It means that you're an expert in your area, so you can actually use that as a strength. You can leverage that to even work on the other areas that have been dormant in your life. And then the other aspect is, you can be able to seek out a mentor at workplace. This could be a senior colleague or even a teacher. For example, if it is at workplace and you have gotten a promotion and you don't know how to survive in that particular position, just talk to someone who has been in that particular position to tell you, how that position looks like and what you need to do. If you have gotten a new job and you are finding it hard to adjust to that environment, get someone to help you walk around, tell you about how the organization is all about, some of the things that you need to do. That will help you to be able to adjust faster and to ensure that those symptoms, the imposter syndrome, don't last for long. Because as I said, for some people, it can be able to last for quite some time. So if you can be able to get a mentor, then the mentor can be able to help you, to show you the way. And then the other thing is evaluate your environment. So look at the environment that you're working on, or the environment that is bringing up those imposter feelings. So is it toxic environment? And when I talk about environment, I may not just talk about the physical environment, but I'm looking at even the people around there. Are there some form of toxicity? Is there something that you can be able to do about that? Is there too much competition? So evaluate your environment, understand your environment so that you can be able to know what you need to do. And then it's also important that you remind yourself of what you have been able to accomplish. The fact that you have been able to be given that position, the fact that you have been able to get this new job, it means that also the other things that you have been able to accomplish. So always remind yourself that yes, you have been able to excel in other areas. So yes, you can still be able to excel in this particular area. So don't dwell on the negativity, but you can also be able to look at the positive aspect. And then when it comes to now the therapeutic intervention, what we as psychologists do, especially for people who are presenting with imposter syndrome, as I said, most of the time they'll be screened with depression or even anxiety and other comorbidity, maybe low self-esteem and all that. So we are screening the feelings and other comorbidity. So when we are able to screen for those symptoms, for those mental disorders, then what we do, we are able to use the evidence-based therapies like cognitive behavioral therapy. There are a number of therapies that we are able to use so that we can be able to manage the condition. So based on what the person is experiencing, when we realize that maybe the anxieties are too much, even able to sleep for quite some time, sometimes we might the intervention might involve even medication to be able to help the person relax a bit to manage as we try to look at the underlying problem. So, and sometimes when we also see having low self-esteem, we also want to look at what is actually bringing that low self-esteem. Is it based on their minority, based on their socioeconomic status? Someone has gotten a job in a place where they feel higher socioeconomic level. So we want to explore that, and a number of interventions can be used to ensure that we deal with the underlying issues. So once we deal with the underlying issues, it will be able to ensure that this imposter syndrome will be able to go away. So depending on what we are going to screen, then we can be able to have an intervention based on that. Uh, so what we do sometimes where they can be able to discuss with their peers, their co-workers who have also been able to go through the same feelings of self-doubt, and that might be therapeutic in a way. When people are able to come together and discuss what they are going through, that will actually help. They might feel that they are not alone, and it will be a support group in a way, and they might also now try to see, how they have been able to manage each one of them. Maybe they're at different levels. So someone was feeling like that maybe a few years back, but now they're okay, and they can be able to share tips on how they have been able to overcome that. So that can also help. So so therapy intervention, psychologists can be able to help individuals to overcome this, and also in addition, addition to some of the individual tips that you can be able to take that I've talked about. So in conclusions, what are we saying? We are saying that employees and employers should be educated about imposter syndrome to take steps to mitigate the psychological impact of this condition. So because many people don't know about it, they just experience it, but they don't know what is going on. They might think like it is just a stress. They might think that it's just a feeling like any other, so they don't know. So when people get to know about this, then this necessary steps can be taken so that they are able to ensure that they are mentally okay. Yeah, so that is what I had for today on imposter syndrome. So there's a lot that we can talk about imposter syndrome, but for today, that is what I had. So I don't know if there's any question that.
Yeah, there's a question. There are a few questions. Um, One of the questions asked in the chat box is, how do you differentiate between imposter syndrome and anxiety or depression? How do you know what you're having is
Mm,
imposter
mm,
syndrome and not anxiety?
mm, mm. Okay. Okay, thank you for that particular question, Martin. Because when you talk about anxiety, I know anxiety, we also have different types of anxiety. And one of the anxiety that I've talked about is the social anxiety, where people fear, social places because they might feel incompetence. So how you differentiate imposter syndrome and anxiety? Most of the time, imposter syndrome is actually related to work. It happens in work situations, in work related situations, where someone might feel like they don't whatever position, or maybe they feel like they doubt their skills. So you realize the fear is mostly related to what to do, because social anxiety, it will be more of a social setup, not necessarily the work, but it also cuts across other social setup. But now for this one, it has to be related with the abilities. So the fear here is related to the abilities, doubting the abilities, that people are going to find out that they are not as competent as they think. So here, the main thing here is abilities. So there is what is causing that. So that's how you can be able to differentiate. And that's why even for us psychologists, when people come to us, we want to explore where these feelings are coming from. So when we are able to know where everything is coming from, then that's when we can be able to do what? To draw a line. Because you realize that when it comes to mental health and assessment, there is always a very thin line between one disorder and the other. So one particular thing can be able to differentiate one from the other.
Okay. Another difficult one. How do you differentiate imposter syndrome from actually being weak in a certain area?
Mm, mm,
Like, how it could be imposter syndrome where it's you not believing yourself,
mm,
but it
mm,
could be a case
mm,
where you're actually weak in the area which you're not believing yourself in.
mm,
How do you differentiate the two?
okay, okay. Just as I said, this imposter tendency or imposter syndrome, most of the time it affects people who are driven to achieve, people who are high achievers, most of the time. That's what normally happens. Yeah, so differentiating between this and maybe lack of abilities. In this particular case, when someone doesn't have the abilities to do a certain thing, they'll actually know. And maybe they may not even get that praise. They may not be told that you have done a good thing. Remember, with the imposter, they'll be told that you have done well, and they still doubt that. But you see someone who is still struggling, you'll find that they'll always be complaining about what they are doing, so they don't have the abilities. So you see now in that particular case, there are two things that are there. So someone here always getting negative feedback of what they are not able to do, but here they are getting positive feedback, but they don't believe that.
Okay. Another one, if somebody has imposter syndrome and in brief, and they call you
mm,
because I know there's a lot you can do.
mm,
Somebody has imposter syndrome and they call you or video call you in when you're seated in HealthX.
mm,
Um, Overall, what would you do to help them recover from
mm,
this?
okay.
Yeah, how will the therapy look like for that case?
Okay. Okay.
Uh,
Thank you. Thank you. Thank you for that particular question. So, in this particular case, when someone calls us, first of all, it will start with assessment. That's how therapy starts. So, we'll be able to create a rapport with that particular client. And then, once we have been able to create a rapport, then the first thing is we'll want to do the assessment. And with the assessment, we'll explore what the client is presenting. We'll explore the presenting issue. So the presenting issue here is the client will talk about what is going on, what they are feeling, what has been happening, the duration of their symptom, how they have been affected in one way. Because you find that, as I said, this imposter symptom can also lead to burnout. It can also lead to low productivity at some point. So we also want to find how affected are they, how distressed are they with this particular issue, and everything that is there. So once we have been able to do the assessment and we have been able to pick the issue, and in case there is any comorbidity, just as I mentioned, maybe depression and anxiety. So what we'll do, we'll be able to contract, a number of sessions with them, and try to look at each one of them, each one of those items that are there. If it is low self-esteem, we will want to see how we can be able to do what to boost, their self-esteem, because maybe their low self-esteem is coming from the negative view about themselves. So we'll want to restructure the way they think about themselves. Yeah, so that is one. We look at maybe depression, if they're also having that. So we look at that. So based on the issues that are there, we'll be able to structure the sessions with them, and then using the evidence-based therapies, we'll be able to work on those items. Because if we just work on just the symptoms, and you are not looking at the underlying problem, most likely this client will come again. And for us as psychologists, our main aim is to ensure that we empower our clients, so that whenever they are faced with other issues, they'll be able to deal with them on their own, so that they don't have to keep on coming again and again. So once we empower an individual by ensuring that we have been able to look at the underlying issues, then they can be able to use the skills that you have taught them, even to work on the other areas of their lives.
okay, amazing, amazing. I've learned quite a lot from for the last 1 hour. It's been quite educative, and I'm sure everybody else has learned a lot too. There are no other questions. So thank you very much, Sylvia, for taking us through that. Remember, we usually have these sessions, I think, every 2 weeks. Um, yeah, we normally have this session, this sessions on mental health and nutrition also every 2 weeks. So people are welcome to join in at any time. But thank you very much. Personally, I've learned a lot, and I'm sure everybody has learned a lot. Was there anything else you wanted to share?
Not really. Not
Ah,
really.
okay.
Mm.
All right. Asante sana, ladies and gentlemen, and have a good night. Imposter syndrome and an imposter syndrome free life. Thank you.
Thank you. Bye bye.
Bye.